Um, Hello, everyone. Welcome. Good afternoon. Warm welcome to today's lung cancer webinar on peer-reviewed publication in lung cancer research. My name is Magda Korczak-Mleczko, and I'm very proud and honored to be a host of today's webinar. That's my very first with Luce. Thank you for having me. And that's a part of the program called Education and Capacity Building, which is part of Luce's agenda. At the beginning, a few housekeeping notes. So before we just dive in, I wanted to let you know that this session is being recorded and it will be available on demand after the event where you will be able to rewatch it. Everyone is currently muted. And you will remain muted during presentations. Afterwards, you will be able to unmute yourself and ask questions. The mute button is on to allow smooth presentation of our today's guests. And also, I would like to strongly encourage you today to ask as many questions as you can. We have esteemed guests, so you can always use chat and the Q&A feature. And once the presentations are over, we will dive into your questions, into your comments and observations, and you will be able to discuss it with today's guests. So you might be wondering why peer-review articles and why we are discussing this topic today. It's clearly that in today's world, we are surrounded by loads of information, but sometimes it's difficult to find out what does make sense. And the scientific research seems to be out of reach for some of us. Many patients, caregivers, and advocates want to understand the science, which shapes the treatment, but navigating through all peer reviews publications can be difficult, and it's filled with technical language, and it's filled with analysis of complex data, with paywalls. So this is exactly why today's session matters, because together we will explore what actually peer-reviewed publications are, and how we can find and interpret information efficiently, how we can understand what is written, and how this can empower better decisions, stronger advocacy, more meaningful conversations with healthcare professionals. So how to interpret it and read the information which are there and which we can have access to. So today I would like to welcome our two esteemed speakers. First of them being Dr. Anne-Marie Baird from the Trinity College Dublin. Anne-Marie is a leading figure in lung cancer research and in scientific communication. And she's also a former long-standing president of Lung Cancer Europe. So Anne-Marie will be walking us through the essentials of understanding peer review publication and scientific evidence. And her presentation will cover levels of evidence, so how to understand different types of research, what is the impact factor, what it means, how it uses to evaluate the information we access, how to find research publications, different access studies, what is the best way to go through pages and pages and pages of information and science, and also how to understand it and interpret it. What is the usual structure of scientific papers, how to take a critical approach and understand what is written, how we can use it to leverage our work or our advocacy or conversations about health. And we will also hear today the patient advocate perspective, Diego Villalon Garcia from Fundación Más Que Ideas from Spain. He also will share his patient view on how to read and interpret papers, how to navigate complex terminology, medical wording, and how how to use it when needed be, and also what's the role of advocacy in research and publishing. So we will very soon give a floor to Anne-Marie. As mentioned before, please just keep your questions on the chat. We will address them once both presentations are over. And without any further ado, welcome Anne-Marie. We are looking forward to hearing your presentation.
Thanks so much, Magda, and thanks very much for having me today to talk a little bit about peer-reviewed publications in lung cancer research. So this is a little bit of an outline of what I'm going to cover over the next 30 minutes or so. I appreciate it looks like a lot, but some of it I'm going to touch upon and some of it I'll go into a little bit more detail. And obviously, as Magda has said, there's going to be opportunity to ask questions, but I think all of you know me well enough by now that feel free to drop me a message or an email either. So I'm going to talk a lot about what peer review is, what the process is. I also just want to touch upon levels of evidence because this is something very important to have in the back of your mind when you're looking at peer-reviewed publications. Something that's not talked about so often within the advocacy space is around impact factors of journals and something called H-index scores. So I'll touch upon those too, and then I'll go through some sort of hints and tips around publication searches, the importance of peer review in terms of advocacy, some of the challenges that's associated with peer review, because obviously I'm giving you an overview, but some of the things in peer review, it's not perfect. There's issues and challenges, and I just want to touch upon some of those and then give you some take-home messages as well. So the peer-reviewed process, and this is a very simplistic image of what the peer-reviewed process looks like. So it's, in this example, it's talking about scientists, but it's where someone has a question and you want to study it, whatever that might be. So you go, if you're a scientist, you'd generate your research question. You'd look at the methods that you need to put in place in order to help answer that research question. You generate the data, you go through the data, analyze it, and then you would write up those results. And obviously the aim is then to try and get them published in a peer-reviewed journal. So you'd send that off to a particular journal that you had identified. And obviously identifying a journal is going to depend on what your research is about, how much data you have within the research you're submitting. And obviously journals have a certain scope. So you would need to read up on what the scope is of that particular journal. It'll be reviewed by an editor, and the editor can then decide, is this research paper worth sending out for peer review, or is it a case we're going to reject it outright and send it back and it doesn't get out for peer review? So that can happen. But hopefully you get past the first step and it goes out to peer review. The rule of thumb is usually there's a minimum of 2 reviewers that would review your research, and they would go through and provide feedback then to the editor, and that feedback would come back to you. And if you get through all of those things, if you're able to answer all of the different feedback queries, whatever it might be, of course, the ultimate aim then is to meet all of the standards that are in place to get your research published within a journal. But it can feel a little bit like this at times when you are trying to publish a paper or publish research. There can be a lot of bends in the road. There can be a lot of different things that can happen. And I just thought this image sort of sometimes describes the mentality that some of us feel when we're trying to get research work over the line. So when we think about peer review and trying to see what we can do a little bit differently, things have changed a little bit now in that you can have what's called certain preprints. And preprints is where your data hasn't been peer reviewed just yet, but you're sort of putting it out there within the public space. And that gives people an opportunity to look at your data and give you feedback on your data. And there's evidence to show that if you do this with your work, you can end up with a much stronger paper that you would go on to submit for peer review. But not everybody would submit a preprint or a work in progress. Some people will go immediately on to, as I said, the editor, into the journal, and so on. But things have been changing, and people have been using this sort of preprint function a little bit more. But whether you go the preprint route or the direct route, you really want to try and have things that are open access so that anyone who wants to get access to your research study to read it can, and then that you can have your research in such a way that it's easy to find and that you can have PDFs or whatever it might be from your research as well. So two databases that I'm just going to show you here is one around health sciences and one around biology. So these are two that have come online recently enough, and they're basically around this phenomenon of that kind of preprint. So getting your work out there into the public domain before it's peer reviewed. And as I've said already, there's some research to indicate by having it out there, by having people being able to access it, and feedback on your work and your data can actually strengthen your research paper before then it goes for peer review. So things are changing a little bit within this space. So when we think about the peer review process, as I've mentioned already, there's lots and lots and lots and lots and lots of different journals out there. All of these journals will have a certain scope. So within the scope of the journal, they will quite clearly state what they will look at. So is it that they'll only sort of look at clinical trials? Are they open to sort of more basic research where maybe you're working in the lab with cells or something like that? So you need to make sure what you're doing and where you want to submit it to fits within the scope, that kind of criteria that the journal gives. You need to then, when you've put it in, obviously it's going to go through that period of peer review that I spoke about when I showed you that diagram, where it's going to undergo that critique. So people looking at your data, looking at what are the sort of positives or negatives of your data, maybe where things need to be strengthened, maybe where you've missed something within the data. So say if you're doing lab experiments, maybe they feel you need to do additional experiments in order to fully reach the conclusions that you've come to. So usually there might be a process. If they feel that your work could be accepted, reviewers can sometimes come back and suggest changes, and then you go back then and you try to rebut that kind of feedback that they've given. So whether it's adding more experiments, where it's either maybe changing the layout of your paper, whatever it might be, it can really vary depending on what your work is and where you've submitted it to. The idea of the peer review process, ideally, it should be balanced and it should be fair, so that when you're getting your work critiqued, it should be done in a very fair and balanced way. And as part of the peer review process, you can have different types of review. So you can have a single blind, double or triple blind. So single blind would be the authors are not known. So say, for example, if I've submitted something and Diego was going to review, Diego wouldn't know that that work was my work because he wouldn't be able to see that. Or you could have double blind, whereas the reviewers and the authors are both blinded. So it kind of helps to reduce that bias. You can have triple blind where the editor doesn't know. So it's the idea of these different review processes is really to try and help with the sort of the transparency, the bias and all of that. But one of the common ways is really open. So this is where both the authors and the reviewers are known. So Diego would know that I've submitted it, and I would know that Diego has reviewed it. But really, this varies depending on what journal you would submit it to. You have to, though, be careful when you do review something. If you've a competing interest or you've a conflict of interest, the reviewer should notify the editor of that, so a different reviewer can be put in place for the process. And then from that process, it looks like it should be a very quick process, but it can take a lot of time. The outcome then of the peer review process would be whether they'll accept your manuscript, whether they'll suggest revisions for your manuscript, or whether they'll suggest to reject your manuscript. So it'll just vary on, again, what the study is and what the reviewer's comments and things like that have been. Because sometimes a reviewer could make a comment and it could be a very valid comment, but for whatever reason, you may actually not be able to maybe do those additional experiments, or you may not be able to appropriately give an answer that completely satisfies the reviewer in the comment that they've made. So if we think about papers that undergo peer review and maybe there might be a rejection, people always wonder why something might be rejected. So you'll often hear people talk about, well, at least in the space that I'm in, about papers that may have been submitted and then, you know, it's been a lot of time and effort, but for whatever reason, the paper has been rejected and you have to kind of go back to the drawing board a little bit. But there's some reasons why papers might be rejected. And I think it's important to have a little bit of an idea about that just for yourself when you might be looking at something or hearing of a study, or maybe you've seen a study somewhere, but it hasn't actually undergone peer review. The research question that may have been asked could have been unclear in that you're really not too sure what are the authors trying to address within their study. Maybe the research question is clear, but maybe they've gone about it in the wrong way to try to address it. There may have been a duplication of previous work. So maybe someone else has published a very similar study and there's a worry about that overlap and duplication. There could be an issue with the design. So maybe the way in which the study was designed was not actually fit for purpose. So even though you've generated data, the data really isn't in line with what you should have designed your study to be in order to answer your research question. Sample size is something that is really, really important. Sometimes you'll go out and you'll look at papers and it'll be like, it'll have a wonderful title as if this is the next big, huge thing. But then when you look at it, you might see that the sample size is really, 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 really small, and it's really not adequate for what the authors are trying to look at. So they're kind of making very kind of broad sweeping conclusions based on a very teeny tiny sample size. But again, that will depend on the type of research and the study that's been undertaken. Methodology and/or the statistics can also be an issue. So again, have they used the proper techniques to study what they want to study? And one of the issues can then be about statistics. Have they actually analyzed the data in the most appropriate fashion? Because sometimes if the data isn't analyzed appropriately, you might get a significant result, but you're only getting that significant result because the statistical analysis used has not been the proper analysis that they should have used originally. You can also have issues whereby there might be lots of different conclusions that are drawn in that section of the paper, but when you read through the conclusions and you look at their results, it's not actually backed up by the data at all. So there can be really a number of different issues as to why something might go through peer review and then be rejected. So these are just some things to keep in mind. So I did say I wanted to touch upon evidence levels. So obviously we have what's called a sort of a pyramid of evidence levels. And what you can see here is from where there's a less bias, there's a better evidence level. And you can see here from the bottom straight up to the top. So something like basic research or sort of basic mechanics, whereby, you know, maybe you're looking sort of at a basic research where you have maybe experiments on cells, or you're doing genetic studies or some sort of material development, that's going to be really at the bottom level of evidence within this pyramid. And then as you move up the pyramid, that level of evidence increases. So if you think about here near the top, where you've something like a systematic review or a meta-analysis, that's really about combining a lot of data, looking at it very quantitatively, looking at it in a very systematic fashion, and then also taking account of things like sample size within various studies and what that impact has had on the outcomes. So when you're looking at papers, within them, they should identify what type of study they are. And then you could use this level of evidence pyramid to help you understand where it falls. Is it something that's very basic at the bottom, or is it something that has a high level of evidence because it's near the top of that pyramid? So, after we talk about levels of evidence, one of the things I wanted to touch upon was impact factor, and that should be H index, H index rather than H scores. But an impact factor, I'm not too sure if a lot of you have heard of it, but an impact factor is to do with the average number of times articles from a journal published in the past 2 years have been cited. So basically, it's where there's a lot of research that's published by a journal. Is that being cited by other studies? Is it being used as reference material of other studies? Is kind of a very simple way to look at it. And the impact factor can vary from something that's very low, so maybe like an impact factor of say 1 or 2, to something that's very high, which could be like in the 80s or the 90s or even more than that again. So this is also something to consider, because usually the more data you have, the better data you have, you tend to be able to publish in higher impact journals. But that's a very sort of generalized view that I'm giving you of this. The H index then is more to do with the author. So when you look at clinicians or researchers that are publishing studies, whatever type of studies that they are, there can be what's called author level metrics. And that is really looking at how many papers has the person published and how many times are those papers being cited by other people, and then that will generate a H index. But it's important to say that impact factors and H indexes are metrics, but in no way are they perfect. And when you're looking at author level metrics, there are others outside of the H index. I've just given you a H index example, but something like Google Scholar can have a little bit of a different type called the I-10 index, and that's calculated a little bit differently. So again, have a look out, see what sort of metrics are being generated, and try to understand how that metric is in of itself being generated. So in the next 2 slides, I just want to know this is for example purposes only. I am not trying to say these are the best journals or anything like that. I just want to give you a bit of an example of what it might look like. So as everybody is going to AI these days, I thought I better up my game and go to AI and ask AI about highest impact journals in thoracic oncology. So this is some of what AI fed back. So again, as I say, this is just for example purposes. So I wanted them to generate something for me that specifically looked in thoracic oncology, because for the purposes of this presentation, that's specifically what we're interested in. So you can see here some of the journals, and you may have heard of some of these. So the Journal of Thoracic Oncology, Cancer Cell, JAMA Oncology, and you'll see the number then beside them. So for instance, Journal of Thoracic Oncology 21, something like Cancer Cell 48.8. So these numbers reflect the impact factors that I spoke about before of those particular journals. So if any of you are looking at this, they're probably like, AI made a big mistake. Where is New England Journal of Medicine? So New England Journal of Medicine tends to be, and again, I'm giving you a very general statement here, tends to be where a lot of the trials are published in. And the reason why AI didn't spit that back to me was because I was looking specifically for thoracic oncology. And obviously the New England Journal of Medicine publishes studies on all sorts of types of cancers and conditions. And it's not just about thoracic oncology. But the 2023 impact factor for the New England Journal of Medicine was 96.2. So you can see that it is very high, and it would be a journal that would be very well respected. Again, I want to stress this is for example purposes only, and I went to AI again for this. So I asked AI what journal or what authors might have a high H index in thoracic oncology specifically, and it generated some names, but again, this is example purposes only. So, you know, it could be maybe you aren't too sure where you should start off looking for maybe an author or a journal if you're looking for specific types of studies, and this could be something that might be helpful in that initial signposting. But again, example purposes only. I can't stress that enough. So some of these names may be familiar to you, some of them may not be, but this is what AI gave me back for some of the authors that are publishing a lot within the thoracic oncology space. So what I've done is I've taken one of these names to give you an example. So I've taken Solange Peters. And for Solange Peters, so in my head, I'm maybe going to do a study where I know Solange Peters may have published quite a lot for argument's sake. So there's a site you can go to called Scopus. So I've gone on to Scopus, and it'll give me an author profile, in this case of Solange Peters. It will tell me where she works, what different IDs she might have. So these IDs are used to link authors to their publications. It'll tell me how many citations she has had, how many documents, and what her H index is. So as you can see here, as no surprise, the H index is quite high. Within here as well, I can find out other things. I can see all of the different documents that are there that have helped generate these metrics. I can sort by US date. I can filter by a number of different ways and means. But for instance, here I've just done by newest. So it's telling me what it is that's being published. And then you can click to see the abstract or whatever it might be. And then it also gives you other information in terms of what the documents are across the years and what the citations are as well. So it gives you a lot of information on different authors that maybe you want to find out a little bit more about, or you want to see, are those studies something that's of interest to you in your work? And then within this as well, you can also find out the number of citations. So again, this is just an example of some of the papers where Solange Peters has been an author, and the number of times those have been cited. So you can get a lot of different data and metrics around authors and around journals across different sites and things like that. And it is good to be aware of them, because then you can go in and have a little look and see what sort of things that they're publishing and so on. So when you think about you want to go and look for publications, you want to search for them, and you're wondering, how should I go about that? Well, there's a number of different platforms that you can use in order to search for different publications. And again, this is not exhaustive. I'm giving examples. So there's one called ResearchGate, where you can search. Maybe the one that people would know a little bit, what is more commonly known maybe, is PubMed, which is from the NIH. And then a lot of people might use Google Scholar as well. So within this, they'll go in, they'll put in their search criteria, whether or not they're looking maybe for a specific study or a specific author or whatever it might be. And then that'll generate kind of a list of papers and so on from that. You can also have what's called institutional repositories, and institutional repositories tend to be open access digital archives. And what these institutional repositories are really for is to kind of give you an archive of all the sort of scholarly activity that's gone on. And in this case, I'm just showing my university, but it'll give sort of scholarly activity, publications, research related to the institute, and you can also find sort of e-copies of, say, PhD theses, master's theses, and so on. But again, it's going to depend on the specific institution that you're looking at as to what they would have on their institutional repository. And this can be something that people would find useful as well. One of the questions that sometimes comes up is around grey literature, which obviously is another rich source of literature when you're doing a review or you're looking for information. And grey literature tends to be sort of policy documents, government websites, government statistics, that type of thing. So it's coming directly from various agencies or institutions, but they haven't been peer reviewed in the peer review sense that I've spoken to you about. But grey literature is something that people often do go out into to get specific types of information. So of course, when you're reading a paper or you're creating a paper, you need to be very clear on what types of literature sources you want to use. And a lot of times people will use a mix of literature sources, but it's important just to know the different types. So when you're doing your publication searches, there's a couple of things you need to be thinking about. So when you go to search any of these platforms, like, what is your goal? What is it that you're looking to find out more about? What is it that you're looking to see? Are you looking for clinical trials specifically? Are you looking more for basic research? So you need to try and have sort of a little bit of an idea in your head of what you're looking for. Have a think then about what the best keywords might be. So this is if you think of going on to Google or another search engine and you're looking for something, and we're not even talking about peer-reviewed publications here, but it could be anything like, where's the best place to go on holiday or whatever it might be. You know yourself, depending on the words that you punch into that search engine, you're going to get different things back. So you need to have a good idea of what are the best keywords that are going to link back into your goal of finding the information that you're trying to find. Do try to be specific as much as possible. And some of the platforms will give you advice on if you're using and, put it in capitals. Sometimes they'll say to use commas, whatever it might be. So just have a little look at that. So again, when you have your keywords and you want to put it in, you know the best format in which to put it into that platform. As much as possible, try to choose trusted sources because we know there's a lot of misinformation out there. Have a look, is it something that's recognized in the grey literature? Is it something that's trustworthy in terms of a journal? You can then go on obviously and look if, you know, at the authors, whatever it might be, but understand that there are going to be certain limitations within the sources you're looking at, whether it might be how the research was done, the numbers used, or whatever. So it's important to just have an idea around that. You can also apply certain filters. So again, within these platforms, you can use some filters around language or time frame, because maybe you're like, do you know what? This thing that I'm looking at, I know it's only in the last 5 years that stuff has come out. So you can then filter it so that you get it, say, in the English language, for example, and you get it within the last 5 years. Try to focus on the abstract because that gives you a good overview, the methods, the results, and the conclusions. So I know you're kind of going, basically, Anne-Marie, you're telling us to concentrate on the whole paper, but the abstract is a good place to start, because sometimes the title of the paper might be like, oh, this is amazing, blah, blah, blah. And then you start reading the abstract and you're like, actually, the abstract's not necessarily fitting with the title or whatever it might be. So just something to kind of keep an eye on. And when you do go into your publication searches, obviously the papers are going to have a type of anatomy, let's say. So you're going to have that abstract, you're going to have an intro, methods, results, conclusion, discussion, and so on. And there's going to be certain information within all of these sort of pieces of the anatomy of a paper, including the references they're citing, and they might have a lot of supplementary information as well that you can also have a look at. So if we look at that in a little bit more of a condensed form, you can see here I've broken it down a little bit more sort of specifically. So obviously you're going to have the title, which is going to give you a quick idea of the topic. The abstract should be a short summary, and it'll help you to decide if this paper is relevant to whatever it is you're looking at. The intro, you know, people will go back and look at the intro, but basically it really is there just for a bit of background information. And I would say to you, if you're starting off in an area that you haven't really looked at before, try to look at review articles. So articles that's reviewing a lot of the literature that's out there, rather than looking initially at original articles, which are things that are sort of that new hot off the press type of thing. But within then your methods is really important, how the study was done, the results, what did they find, and when they say they found something, are they actually showing a figure, an image to back it up? The discussion, they should be putting their research in the context of what may or may not be out there and what it can mean in, say, comparison to other studies. The conclusion should be sort of that wrap up, but again, look out for people who are sort of overselling their data. References always need to be included, because you don't want to look at something and they haven't referenced their, you know, the information, say, they've given in their introduction or their discussion, and then the supplementary info then is there because it's extra data around charts and other things. But again, this is going to depend on the study. So title, abstract, important. Methods and results are really important place to go then, and then looking at that conclusion, seeing if it reflects back as to what has been shown. So when we think about peer review and advocacy, and I just have 1 or 2 slides left, you know, if you're in the advocacy space and you want to publish some of the research that you've undertaken, it's good because you're going to have evidence-based of real-world information. It's going to help build credibility for the work that you're doing and the work that your advocacy organization's doing, because you want to become a trusted source. And then if you can peer review publish your advocacy work, that can then, you know, have knock-on benefits and be influential if you're looking to apply for a grant, if you want to, you know, go to policymakers, or if you want to tackle misinformation within your own space. It can have a lot multiple advantages. So when we look at advocacy in sort of peer review as well, some journals are now getting advocates to be part of the peer review process. So advocates that are acting as a reviewer for a specific study. But this is by no means the norm, but it is happening in some instances. You might be playing a co-author role in a study. So my advice to you is, if you are a co-author within a study or a publication or whatever it might be, just make sure that you are able to give your input and that has been taken on board. And if they're not taking it on board, why are they not? Like, are they having that conversation with you? If you are involved in any of these studies as a co-author, or you're doing something yourself within advocacy, try to advocate for increased accessibility, which is open access. So this means things are not behind a paywall. And of course, the more people that are involved in the peer review process, it'll help with the rigor and transparency of the data we're seeing, because as I say, the peer review process is not perfect. So some of the challenges that we still have is this paywall issue. You know, you could see a paper that's really interesting, but you may have to pay a significant amount of money to get access to it. So we really need to ensure we have more open access. We need to ensure that there are more plain language summaries so that people can understand the complexity a bit better of peer-reviewed publications. We need to understand that there could be a bias in terms of the publication and the review process, because people can come with implicit biases or whatever it might be, and that can have a knock-on effect. And really then that whole transparency in terms of the process itself, I feel we need to get better at that in some instances. And I would be remiss of me to not mention AI. Obviously, AI is being used in a huge amount of things, but just be very careful, because obviously with AI, you're going to get certain, or at least you could get certain issues around that. You could have a bias issue. There could be transparency. You know, who's going to have the accountability? Are you going to have an over-reliance on it? Could people manipulate their papers in such a way that you're kind of feeding into AI algorithms, and then you have a better chance of your publication being accepted, for instance? So there are a number of challenges. And one word on negative studies, and I promise I only have one more slide after this, is we hear a lot about studies that maybe were negative. So they set out to answer a certain research question, and maybe they said, I don't know, I'm going to make this up, drug X was better than drug Y, for argument's sake. But maybe then drug X wasn't better than drug Y. And sometimes those studies might not get published. But it's really, really important that negative studies be published, because you're completing the information that's available. You're helping in terms of reducing bias. You're helping to inform future research, supporting ethical research, reducing misleading conclusions. So really important. And my take-home messages are really, at the moment, peer review is really the gold standard, but there are issues. It's not perfect. Try to become a little bit more aware of the metrics, so then you can sort of judge based on that levels of evidence PubMed as well. Try to be smart about your search in terms of the keywords that you're using. And I think advocacy can come on even more by publishing their work, because we need evidence-based research in advocacy too. So thank you so much for your time. And I'm going to stop there and hand over to Diego.
Thank you so much, Anne-Marie. Let me check. I hope that you can see my, well, now is the banner of the webinar. First, let me say thank you to Anne-Marie, because I love your speech, and I was taking a lot of notes here. And as usual, it's been a pleasure to share a webinar with you. So thank you so much. And let me also express my gratitude to Lung Cancer Europe for having me here and share my experience on this topic. To be honest, when I received the invitation to participate on this webinar, I felt a little bit overwhelmed because I'm not an expert on this subject, and Marie is. So the best part of the webinar, it was the part of Anne-Marie, and of course, together with the part of questions and answers that we will have in a few minutes. So today I will take only a few minutes of your time, and I will tell you my experience on why and how an advocate like me, without any scientific background, became gradually involved in research, and also I will share some of my learnings and some of suggestions about how to navigate in these platforms, about how to read articles. So I really hope that it can be useful. Well, I've been advocate for 20 years, but really I've been involved in research around 15. And I've been involved in the promotion of different research projects, mainly focused on identifying unmet needs of patients, priorities, preference, etc. Because as Marie said before, advocacy needs evidence. So I think that's really important. But I have been also involved in different research committees to provide the patient or the citizen perspective. And I believe this is really important because we can contribute a lot to make research more patient-centered. I think that this is really important, and we sometimes advocate for more research, and we should remind that we also need to advocate for a better research. And we, as patient advocates, have the opportunity to provide a unique knowledge, unique data about the real needs and priorities of patients and caregivers that sometimes researchers are not very familiar with. So to do that, for advocates, it's really important to be connected to and listen to our communities. We need to ask our communities, but we also need to be informed about ongoing studies and visit platforms such as PubMed or ResearchGate, etc., in order to read scientific papers. But the problem here is that it's like we sometimes feel a little bit lost in these platforms because the language is sometimes very technical, and if you don't have a specific training or knowledge, it's really difficult to find relevant papers or even to know if a specific research is relevant if you are not familiar with or you don't have specific training. So now let me give you some tips first about how to navigate into these platforms. Some of them have already been said by Anne-Marie, but this is amazing because it's a way to strengthen the message. So like a first recommendation is try to be clear and specific about your topic of interest. I love what Anne-Marie said before about you need to define your goal and try to write the best keywords that link to your goal. I think this is really important, and try to be focused on your topic of interest, because if not, you will find thousands and thousands of papers there, and it's really difficult to find the appropriate ones for your search. Also, as you may know, there are different types of study: clinical trials, systematic review, meta-analysis, case reports, narrative reviews and literature reviews, clinical practice guidelines, research articles. All of them can be relevant. I'm not pretending to say that some are better or are more appropriate than others. No, I think that all of them have their use. But from a patient perspective, if you are not very familiar or you don't have a lot of expertise reading scientific papers, I suggest to start reading systematic reviews and meta-analysis, because this type of studies summarize and analyze the main results of previous studies. So it provides you a big picture view of a topic. So I think that this is a good point to start reading scientific articles. But I also suggest to read clinical practice guidelines, because these are expert consensus documents that offer some guidance to doctors about how to treat patients with specific diseases or with specific conditions. So for us, it's really important to understand the standard of care and also try to explore and identify needs or areas of challenge that we can advocate for. The following topic is about something that also Anne-Marie commented about. She mentioned the importance of open access journals. You should remember and take into account that sometimes you won't find the full articles accessible. So sometimes you can find them, but sometimes you have the possibility to ask for access. You can request the access. Sometimes I can read that you have the possibility to write an email and request a specific article. And so most of the times they respond very quickly. But also, if you have a scientific committee in your organization, if you have people around you that are scientists or healthcare professionals and can support you, you can ask them to have access to these articles. And also, if you are not very familiar like me with scientific community, scientific world, it's sometimes difficult to understand if a paper is relevant or not. So as it was mentioned by Anne-Marie, the type of journal will be an indicator for you, as well as the authors that are behind that paper. Other issue that is important is when reading an article. And here you have some of my learnings or suggestions. Feel free to accept them. First of all, I would say that I think that the first thing is to read the abstract, because you will find a summary there, and you can find if it's relevant for your search. And if it's relevant, go straight ahead to conclusion. I mean, I would mention later what I say that. I think that first is to read the abstract, go directly to conclusion, and if you feel the article is relevant and is connected to your point of interest because of your advocacy work of your research, you can then read the full article and check the sample size, the date of publication, the methodology, how the data is being collected, and the conflict of interest. All of these are really important. The date of publication has more importance depending on the topic we are talking about, but it's important to know when the study was made, and also the conflict of interest. And let me give you an example. One of the most famous research supporting the use of vaping, the electronic cigarettes, to quit smoking. That research, that paper had a lot of conflict of interest. I mean, many of the authors have received fundings from tobacco industry. So there is a clear bias there. So that's the reason why the conflict of interest declaration is so important when reading a paper. And also, for advocates without a scientific background, please don't be afraid of the methods section. How the data is collected and analyzed is really important. But for us, it could be a challenge to understand the concept, the analysis methods. So if you don't get it, don't worry. You will learn step by step, and you can check only the abstract, the conclusions, and also the discussion section. It's great to read this part, because sometimes the authors share some reflections or even some ideas about their findings. So don't be afraid, please, about the methodology, because it's completely understandable if you don't get something there. And of course, don't let the terminology hold you back. That's a challenge, especially if English is not your first language. So my suggestion is that use Google to understand, to know better about the different terminology. And I promise that every time that you read more and more and more papers, you will become more familiar with the terminology. It's not so complex as it seems, okay? And the last minutes of my intervention is about when publishing an article. That's here. Well, for me, this is a personal opinion. Let me know if you agree. But for me, I think that there is a lot of information noise on the internet and also in academic journals. So please first think if your data is enough relevant to be published in journals, because I think that sometimes we are trying to publish everything that we collect. And I think that the first step is to think about our data. It is relevant. What is the message? What is my message? What is the contribution that I want to make to research? Define your purpose. I think that that's the first step. Select the right journal. This was mentioned before by Anne-Marie. It will depend on the topic, on the type of research, the methodology, the relevance of, or even the quality of your research. There, you can select the right journal to try to publish your manuscript. And you can be helped by researchers. So the best thing is to involve in your research to clinicians or other people that can help you in this process, because they can offer a better guidance. Try to keep your writing clear and concise. That's an important issue. And also remember that your perspective, our perspective as advocates, is a strength when publishing articles. This is like an added value. So try to focus also on your perspective as advocates. And finally is review the journal's guidelines previously to avoid last minute issues. Because sometimes you can find that these journals have some guidelines or even some forms, or even they can send you some, I don't know, some other examples, practical examples that you can use to submit some of these articles. So just to conclude my intervention, just to say that our voices are important, so they need to be heard. As patient advocates, we have the opportunity to contribute and enrich scientific research. So getting involved in research is not just only a possibility, it's really powerful. So I encourage you to be more involved in research to get that research is more patient focused. That is what all we are working on. So thank you so much.
Thank you, Diego, for this presentation. It was great. Interesting comment at the end about the conflict of interest, indeed, a big topic, especially with the interference of the industry, such as tobacco industry. And Marie, so many interesting tips. I learned a lot definitely during this webinar, so thank you for this. We have just a few minutes left, literally, and I encourage everyone who attended to raise your hands and use this opportunity to ask questions. Do you have any questions? Please, the floor is open for them now.
So Mike, just as everyone's thinking of their questions, I did reply to some of the questions in the chat. But the conflict of interest thing that Diego talked about is really, really important. And all journals do have guidance around conflict of interest. And say if you're submitting a paper that's has been accepted for publication or is going in to be reviewed to see if it's going to be accepted, you have to submit conflict of interest forms with those. And a lot of journals are also very strict, as Diego said, on the tobacco funding piece as well. So there are a number of guidelines and processes and procedures in place to try and help manage that. But again, as I said, not everything is perfect, if that makes sense.
Thank you for that. That's a very, very valid comment. So we have We have a comment from Chiara saying that there's evidence that involves patient advocates in shaping research questions improve the quality of research, but how can patients get in touch with researchers to participate in the process? Do you have any recommendations?
So I had responded to that quickly in the chat, but really, I think it's, I don't know if you've heard the term brass neck, but it's kind of a bit of putting yourself out there. You know, if you have an opportunity to get to conferences or meetings and there's someone there whose work you are really interested in, or you've read some of their publications, go up and try to speak to them, introduce yourself. What I would say is kind of have your elevator pitch prepared before you go. So what is it that you want to say? What is it that your ask is going to be of them? So is it a case you want to get involved in their research? Is it you just want to find out more? Whatever it is, try to do a little bit of prep beforehand if possible. But go up to them, talk to them, see if you can follow up with an informal meeting. Maybe you can go for a coffee, whatever it might be. You know, you can also email directly to authors of publications as well. You know, Diego, I've read your publication on XYZ. It was really, really interesting. I'd really like to get involved in the work that you're doing. Is there any avenues in which for us to work together to do that? I mean, it's really putting yourself out there, and the worst that they can say is no. And, you know, at least you've tried. But most people that I have met in the research space, if someone reaches out, they try to help in some way, even if it's just to kind of keep the conversation open and going. But in terms of sort of the advocate review on the journal side, as I say, that's not so common, but you could advocate in terms of getting in touch with journals, asking them about their peer-reviewed process, you know, asking them, is this something that they could do, or how would it work, or whatever it might be. So it's just really putting yourself out there and seeing what's coming back. But I don't think there's any kind of magic one size fits all kind of approach to get those links. But think of your network, like Lucha is a massive network. Everybody within their organizations has a network. Chances are someone knows someone, or someone can help you with something. So, you know, use what's available to you too.
Thank you, Anne-Marie. That's great to know. We are 2 past hours. I don't want to prolong, but Anne-Marie, can I ask you one more question? There was a comment about the DORA, famous DORA, and whether we should be considering limitations of the impact factor. Can you quickly also speak to that?
Yeah, so there are limitations to the impact factor. So depending on the field or the discipline you're looking at, there may actually not be that many publications for whatever reason within that. So you could get a bit of discipline bias. You know, the citation window that people deal in can be short. When you look at impact factor, it's reflection on the journal and not individual articles. So you might have a journal maybe with a mid-level impact factor, but within there might be a publication that's been cited thousands of times. But again, this comes back to you trying to identify where you should place your work so that you know if your work should go to a higher impact journal, that you're sending it to that high impact journal. I mean, the rule of thumb is to start high and work your way down. So ideally, where do you want to go? And then get the feedback or the rejection or whatever it might be, and use that to help when you next resubmit it to somewhere else. DORA is a really great initiative. I put the link in the chat if anyone was looking for it, but it's really around best practices, around publication, and I think more people need to be aware of it, and more people need to use it, because it's really that initiative which is trying to bring people together and really trying to promote best practice in scholarly research. So I think it's something we could create a wee bit more awareness around as well.
Thank you, Anne-Marie. I think that will bring us to the end of our today's webinar. We hope that you found this session helpful to better understand how to access and interpret data. A big thanks to Anne-Marie and to Diego for joining us today and giving us these insightful presentations. And the recording will be shared with all of you shortly. And of course, we encourage you to visit our website, visit our social media, follow the education news. We will have more webinars coming your way later this year. So thank you. Have a great afternoon and a great rest of your day. Thank you.
Thank you so much.
Thank you.
Thank you.
Thank you. Thank you very much.